Hello, and welcome to the Beer with a Scientist YouTube channel. My name is Levi Beverly. I'm an associate professor with tenure at the University of Louisville. My lab does cancer research in the James Graham Brown Cancer Center. Today, we're going to upload the very first Beer with the Scientist talk on our YouTube channel. Please check back for other talks later on. We hope to have quite a large array of content here on the channel to bring science to the general public. If you haven't seen the introductory video on Beer with the Scientist, why it was started and how long we've been going, what kind of talks we've given, please give it a check on the channel there. So today what I'm going to do is I'm going to discuss cancer and cancer research and why haven't we cured cancer. Okay, so I'm going to go through a brief history of human cancer. I'm going to go through the first documented cases, the first attempts to understand cancer. I'm going to go through the history of understanding the biology of cancer, and then I'm going to go through the history of cancer therapeutics. And what I'm going to try to accomplish here today is try to get you to understand why we have not cured cancer yet. Just double check that our feed is going good. Okay. So, as I mentioned in the introductory video for the Beer of the Scientist channel, when I would be out in bars and social settings, people would ask me all the time, why haven't we cured cancer? Among many other questions that I'm going to answer here in this presentation. And so the question is very complex and it has many different answers. Okay. So, but in order to understand any of that, we have to first understand what cancer is exactly. So some people think that cancer is some mysterious thing that comes from the outside, but unfortunately that's not true. It's our normal cells of your body that have gone bad. They've developed properties and things that make them behave in a way that they're not supposed to behave. But luckily, cancer, in order to have a cancer or to develop a cancer, it's what we call a multi-step process, and it's not caused by a single event. So it's not like one thing happens and then you get cancer. What has to happen is you have to get these things in your DNA, which is basically the information that you have within all of your cells that tells a cell to be a cell and how to behave. These mutations are changes in the DNA. And it's thought that in humans, you need at least 8 of these combinations of mutations in order for a cancer to arise. One of the very difficult things about cancers in general is that every cancer is actually different. So for example, if you have 10 women that come into a clinic and they have breast cancer, and the oncologist looks under the microscope and it says, you have all 10 women have type X of breast cancer. Unfortunately, those combinations of 8 mutations that make up each of those 8 cancers are actually different. And so it's actually 10 different cancers, not just one, just because it looks the same under a microscope. So cancer is obviously a horrible disease. It kills a lot of people around the world and in the US. And lung cancer especially, it kills more people than the next 3 most deadly cancers combined, which are breast, prostate, and colon. But so what does this multi-step process look like? I'm saying it's accumulation of mutations. It's a multi-step process, but what does that mean? So here I'm going to show you, in order to understand that again even more, we have to step back and we have to say, what is a cell? How many of them are there, and what are normal processes that protect us from cancer, for example? So a lot of biology is understanding numbers that are really, really big and really, really small. So within a average human body, you have 10 to the 15 cells. So that's a 10 with 15 zeros after it. So that is a lot of cells that make up your body. And cells within your body undergo 10 to the 12 divisions per day. So there's always this fine balance between new cells being made. If you imagine if you rub your arm and you see dead skin sloughing off. So something has to replace those cells. Same thing happens in your gut and your stomach and intestines, and most all organs of your body have to be replaced at the same rate at which they are lost. And there's a fine balance. If you have too much cells that are being made, that's what we call tumors. in most instances, or neoplasias. If you have too many cells that are dying, that's when you have things like neurodegeneration or other types of disorders that are caused by too much cell death. And the problem is these mutations we talked about, these changes in the DNA, they disrupt this normal, what we call homeostasis, which is the balance between normal cells. So this is just a cartoon depiction of what I was talking about, where a cell has to actually accumulate over time many of these different mutations. So if we start at the cell on the left, you can see that one is a little bit darker color, and that's depicting a cell that got one mutation. Well, normal mechanisms would say that that cell would just disappear. It would slough off, it would just be killed, it would just live its life like normal, and then it would disappear. However, if that cell gets a second mutation, which is depicted by the hyperplasia, you can see a little bit different color there on the left-hand side, then that cell has got an advantage to its neighbors. So you can see how normally it should be nice one line of cells. Now they start to pile up on top of each other. And now moving to the right, you can see that cell, one of those cells gets a new mutation. And off to the right, another cell gets another mutation, and so on. Until you get cancer, and then you get invasive cancer. Okay, so this is a cartoon depiction of what happens over time in order for a cancer to develop. And this is actual pictures of human cancers, normal cells and human cancers. And this is tissue, doesn't matter, skin type tissue. But you can see in the upper left, it's normal. And importantly, you see that dark row of cells is kind of purplish, and there's one of them. But as you go to the right and down, those cells start to accumulate, and they start to get very disordered, and they go to places that they're not supposed to go. And that's how the stepwise progression looks in an actual human tissue. Okay, so one of the questions I get sometimes that might seem a little naive, but are there different cancer rates in different states? So like, is it true that one state has more cancer than another state? Or does one country have more cancer than another country? And the question is, and the answer is obviously that yes, it is true. And so what I'm showing here is that actually Kentucky has the highest cancer incidences and cancer death rates in the entire United States. And if you look off to the right-hand side, you can see the key. So the red-colored states are 195 to 211 deaths per 100,000 people. And you can see that 211.3, that's actually is Kentucky. And then you look at other states, like the darker blue, the lowest incidences around Colorado, Utah, and so on over there. And so, certain states have higher cancer incidence. So why would it be? What would be a possible explanation for that? Why is Kentucky ground zero for cancer incidences? And why are we so eager to make a difference here in the state of Kentucky with our cancer research? Well, there's lots of possibilities, and here's just one example. So this is lung cancer specifically. And again, you can see the very dark color is all in the state of Kentucky. So we have the highest rates of lung cancer. And so what could that be? So we have the 120 per 100,000 deaths, 120 deaths per 100,000 people of lung cancer here in, whereas a place like Utah has only 40 people per 100,000. So what could be a reason for that? Okay, well, one obvious reason, and we should all have some idea about this or have heard about this, that smoking is directly correlated or causative to lung cancer rates. So you can see the rate of adults who smoke in Kentucky is over 25%, and the percent of adults who smoke in Utah is under 10%. So that would be one potential obvious answer for why Kentucky has so much more lung cancer. It's a tobacco state, historically. We have a lot of smoking, we have a lot of tobacco industry. But what's something that people might not realize is that there are other things that can contribute to cancer deaths. So here I'm showing on the top age-adjusted cancer incidences by county in Kentucky. And at the bottom, I'm showing you the median household income. And so what you can see here is in eastern Kentucky, they have very high rates of lung cancer. And these actually also happen to be some of the poorest counties within the state. And so access to health care, affordability to be able to get health care, and other things that come along with having a low median household income can contribute to these types of statistics. So we always have to keep multiple things in mind when we're thinking about these. Just pointing out Jefferson County here, which is where University of Louisville is. So again, coming back to this question, so why haven't we cured cancer? Well, my comeback to that when anybody asks me that question is, we've cured lots of cancers, lots and lots of cancers. Right now, over 70% of people who are diagnosed with cancer are alive after 5 years. So that's not a fair question. But what a fair question might be is, why can't we cure all cancers? If we cure lots of people, why can't we cure everybody? When again, this is a difficult question that has lots of answers. Sometimes cancer is just diagnosed too late. No matter what we do, it's just we can't do anything for them. Some cancer types just simply do not respond to any possible therapies that we have available for the patients. Number 3, a curative regimen of a therapeutic might not be able to be given to a certain patient, maybe because they're too old or they have other predisposing factors. We call these comorbidities. They just would not allow that patient to get a curative regimen of a disease, for the disease. So what I want to point out here is that, and this is a few years old, but lots of people die here in the U.S. from cancers. Back in this time, 600,000 U.S. citizens, around the world, 8 million people. But what I want you to see is that 87% of all people who die of cancer are over the age of 55 years old. And I want you to keep that in mind, because one of the questions I get a lot is cancer a new disease? Why wasn't cancer around very often, 100 years ago? Why are more people dying from cancer right now? And the simple question is, if you can think of what do you think was the first year in our history, just in the U.S., that people actually lived on average over 55 years of age? And the answer is 1909. So before 1909, people didn't even live on average to be 55 years old. So imagine if 87% of people who get cancer are over the age of 55. 1909 was the first time people lived on average over that age. Thus, there wasn't a lot of cancer back in olden days. So, and right now, currently, at least 15 people die every minute worldwide. So, obviously, we've all heard of things that are bad for us. Tobacco can account for lots of cancer. Alcohol can contribute to some types of cancer. Diabetes, obesity, being overweight, a poor diet, UV exposure, these things all contribute to multiple cancer types. So the lifetime probability of somebody developing cancer, unfortunately, at this point is about 1 in 2. So 1 out of every 2 people are going to be diagnosed with some type of cancer, especially if you're a man, and it's 1 out of 3 if you're a woman. So coming back to this, is cancer a new disease, and is it a new disease only of humans? Okay, so the short answer is no. Cancer has existed as long as humans have. We say, okay, well, how do we know that? Well, I can tell you that the first documented case of cancer was found in Egyptian papyrus around 2600 BC, and this guy named Imhotep, he documented 8 cases of breast cancer, which they attempted to cure by cauterization, or essentially just poking it with a hot stick. Cancer has been found in mummies and skeletons from thousands of years ago. And then the word cancer itself comes from a couple thousand years ago from Hippocrates. Karkinos is the Greek for crab, and that's where cancer comes from. And then finally, we found fossilized animals with cancer. So I'm showing you here is a bone, a toe bone of a human ancestor that's 1.7 million years old. And that thing on the top there that looks like a lump, that's actually cancer. Here I'm showing you a mummy that was imaged with, I think, MRI or CT, one of the 2 imaging modalities. And the spinal cord is littered with cancers. In fact, here is a dinosaur brain, a skull that has, and this is a zoom in of it, it's a cancer. It's a bone cancer in a dinosaur skull. As So one thing I've heard and that was hyped for a while was that sharks don't get cancer. So if you eat shark fin soup, you'll be prevented from getting cancer. Well, unfortunately, that's not true. There's a shark and there's cancer. Okay. So those are just a few of the things that pop up in conversation. But now what I want to kind of run through is a history of cancer research and cancer itself that we know of. So in order to understand where we are in treating cancer right now and where we are in understanding cancer, we need to understand the first times we ever understood what cancer was. So the first time cancers were kind of actually documented. And so that timeline that doesn't actually go back very far. So one of the first observations of cancer and its potential causes was in 1713, so only a few hundred years ago. This guy, Ramazzini, he reported that nuns that lived in convents had almost no cervical cancer, but they had a much higher incidence of breast cancer. And so this was kind of one of the first observations that a person's lifestyle could actually change the possibility of them developing cancer. A few years later, a guy named John Hill, he published a paper that suggested that tobacco snuff, which is kind of like dry tobacco-ish that you snort up your nose, that snuff was associated with increased incidences of nasal cancer. And this was the first report of a substance causing cancer. So one of the ridiculous things I get asked all the time, or I've heard, is there actually any evidence that tobacco can cause cancer? And I'm like, well, yeah, it goes back hundreds of years, and it's been repeated over and over and over and over again. In 1775, this guy, Percival Pott, what he found was that chimney sweeps, which were typically young boys, because they could fit into the chimneys in London, they very often developed scrotal cancer. And this was caused by the soot from the chimneys that collected in the skin folds of their scrotums. And so this was kind of the first occupational hazard to describe cancer incidences. So what's the trends been like over the past 100 years for cancer survival? So if you walked into a clinic with cancer 100 years ago, you were most likely going to die from that cancer no matter what it was. Again, my numbers are out of date a little bit here, but now we're over 70%. If any random person walks into a hospital with cancer, there's over a 70% rate that person will live for 5 years at least. Okay. So how did we go? And obviously it differs for every cancer type. Some are still terrible, like pancreatic cancer and lung cancer, but some that we've gotten really good at curing and having people live for many years. So how did we go from uniformly fatal to a really good chance that you're going to survive your cancer? Well, again, there's lots of answers. One is better surgical techniques. 100 and something years ago, you were as likely to die from your surgery or infection as you were from the cancer itself if you tried to have it surgically removed. Obviously, we can screen and diagnose better. We have much better therapeutics. But one thing I do want to point out is that there was no systematic way to study the effects of cancer drugs and cancer drug therapies and combinations until 60 years ago. That's when the first clinical trial was actually ran. And so what I want you to understand really is that a better understanding for cancer biology and treatment response because of research is how we got from a uniformly fatal disease to one that we're actually pretty good at treating in most cases. So we got to fast forward a couple hundred years from what we talked about before in the 1700s, where they were starting to put together the links between things you did or things you were exposed to, until we understood that something could actually cause cancer. It was all speculation until then. So there's this experiment that was done in 1915 in Japan, and this was the first evidence that you could actually apply a substance to an animal and cause cancer. So what they did is they applied coal tar to the ears of rabbits every couple days. They did this for weeks on end. And what they actually found was that over time, which is the x-axis here, different rabbits would start to develop cancers on their ears. So this is the very first time it was proven in a laboratory that you could give a substance to an animal, and you could actually make that animal get cancer. Okay, and so similar experiments, again, coming back to the tobacco smoke. This was done in the 1930s. We knew condensed tobacco smoke rubbed on rabbits could cause cancers. Okay, so that was 1915. We went decades, and we were not able to ever study human cancer cells in a laboratory until one of the most important and controversial things happened. In 1951, there was a biopsy of a cervical cancer patient. Her name was Henrietta Lacks. If you haven't read The Immortal or seen the movie, The Immortal Life of Henrietta Lacks, I strongly suggest it. The first time they took cells out of this patient, they had tried it numerous times before, but for some reason her cells grew in a dish, in a laboratory. This was the first time human cells were able ever to be grown outside of the human body. They were termed HeLa cells for Henrietta Lacks, and these cells have been used almost in every laboratory around the world since the first time that they were put into a laboratory. They're important for polio vaccine, they're important for first human cells to be cloned, and there are thousands and tens of thousands of patents using these cells. So it wasn't until 1951 that we could even put human cells into a laboratory and study what happens with them when we do things to them. And just to show you a fun video, hopefully, this is what HeLa cells look like in a laboratory setting. It's not going to work. Well, this is what HeLa cells look like under a microscope in any laboratory around the world. But there are fancier techniques that you can use. Here's a scanning electron microscope image of these dividing HeLa cells. Look a little bit different there. Anyway, so it's really important that we understand the timeline of cancer biology and cancer understanding. So we know millions and millions of years ago, dinosaurs were getting cancer. Thousands of years ago, tens of thousands, humans were getting cancer. Only 300 years ago did we understand the evidence for the cause-effect relationship for occupation and exposures to cancer. 100 and something years ago, first laboratory animals were induced to get cancer. 60-something years ago, first human cancer cells were studied in culture. 50 years ago, the first human cells are put into an animal for study. And only 40-something years ago did we actually understand what is the genetic basis and cause of cancer. So over the span of millions of years, thousands of years, whatever you want to argue, we've gone from knowing absolutely nothing to within the past 50 years, knowing everything that we know about cancer biology in essence. And so it comes down to this, again, to come back to like, why did we go from 20 to, so obviously the biology is important, understanding the biology. But what else? I already mentioned better therapeutics. So you might say, okay, so when did we first start trying to treat patients with cancers? When did that happen? Okay, so what is chemotherapy? Let's take a half step back. It's usually is a poison that attacks your tumor cells, but it also attacks your normal cells. It interrupts processes that are important for all cells. The goals of chemotherapy are, hopefully to cure a patient. If not, at least prolong their survival. But at the worst case, just give them some palliative care just to ease their symptoms. But we all know that these chemotherapies, most all these, can cause terrible, awful side effects. But so how did they come about? And that's an interesting story in and of itself. So in 1915, there was this battle in Belgium where the German army released tons of chlorine gas on a village. They killed thousands of people immediately, but kind of scientifically more interesting, hundreds of thousands of more people died, but it took them up to a year to die. So these pathologists, Edward and Helen Krumbar, they wanted to know why these people were dying so far after the exposure. And what they found is that the survivors, all the survivors that died were dying of severe anemia. It meant that they didn't have any cells in their bone marrow. And the cells in your bone marrow are what make your blood cells, all of your white and red blood cells. And these people the survivors that survived the immediate toxicity, they died later because their bone marrow was abnormal. So this led to a whole bunch of government-sponsored research on mustard gas. And fast forward a few years, these two toxicologists, Gilman and Goodman, scientists at Yale, what they did is they thought, you know what, if this poison messes up the bone marrow, what if we treat a patient who's got abnormal cells that came from the bone marrow? And so what they did is they took this poison that is known to kill people, and they injected it into the veins of a person that had a cancer called lymphoma. And this lymphoma in this patient was like the size of a softball. And after just a couple doses, that cancer completely looked like it went away, but unfortunately it came back within a very short period of time. But this was the kind of first time that scientists injected a chemotherapy into a patient and actually saw a response. And that became an approved therapy for cancer, even though it was never curative. So a few years later, so metastatic cancer is when the cancer goes from one spot of your body to another spot in your body. And it's almost uniformly lethal. It was back in the 50s, and it's not a good sign nowadays either. But there was a guy named Min-Chiu Lee at NCI, the National Cancer Institute in the US. He was treating patients with this methotrexate. And it's an antifolate, and the tumors that he was treating, they're called choriocarcinomas. And the important thing here is that when a patient has choriocarcinoma, that cancer puts a protein into the bloodstream, and we call that a biomarker. It's called HCG. And at the time, the standard of care was to give a certain number of treatments. You would see the HCG levels drop a little, and then you were supposed to stop the treatment. But Dr. Lee, he hypothesized that if I treat a patient with this cancer therapy and the HCG levels go down, but they don't go back to zero or what they were before the person had a cancer, there must be cancer cells in the body still, even though we can't find them and we don't see them. So what he did is he continued to treat a patient with this drug methotrexate until the HCG levels dropped to zero. His higher-ups got word of this, and they thought it was unethical, and they didn't appreciate that he was breaking protocols, so he got fired for this. But lo and behold, that patient that he treated until the biomarker HCG went down to zero was cured of their disease. And this was the first instance of a patient being cured of their metastatic disease. And again, as we talked about earlier, first clinical trial to test cancer therapeutics wasn't done until 1956. So before that, every cancer patient or doctor was just testing things all willy-nilly, like combinations. They were doing whatever they wanted to do. It was like the Wild West of cancer treatments. And there was no systematic way for doctors to share information or to come together and do these things in a large coordinated manner. And so that's, 60 years ago, we weren't even doing clinical trials for cancer therapies. So this brings us to our next topic, which is why recently we've done a much better job, and it's because we've gotten into the age of targeted therapeutics. So what is a targeted therapeutic? Well, the first kind of real hype that came around cancer therapies and targeted therapies, magic bullets so-called, was back in 2001 when there was a drug that came on the market for a very rare type of blood cancer called CML, chronic myelogenous leukemia. And this drug is called Gleevec, and this was the cover of Time magazine. And the reason that there was so much hype for this is because of data that looked like this. So before 1975, this was your survival probability on the y-axis and over years if you had this disease CML. So essentially everybody was dead within 12 years of getting this disease. So we had some increase, some therapies that helped along the way. But in 2001, when this drug came on the market, now all of a sudden 80% of people who have this disease are still alive after 10 years. An amazingly effective drug that cured a lot of patients of this disease and saved a lot of lives. And there are lots of these types of cancer therapeutics that are on the market that target specific genes, proteins in cancers. And this is just a short list of some of the ones that are approved by the FDA. But now I want to touch just briefly on the newest hotness that everybody's excited about, and that's cancer immunotherapies. And these are, since 2013 and up till now, these are the therapies that are using your own immune system to kill cancers. And the reason that this kind of a therapy is getting so much hype and is because it's so effective in many types of cancers, but it also has very minimal side effects. So the first of these immunotherapies that came out, and they all have these crazy names like ipilimumab and nivolumab and so on and so forth. But this is a trial that was done in metastatic melanoma, so melanoma that's spread to other parts of the body. What you can see here is, again, all the patients are basically dead within a year of getting this disease. However, in August 2010, this trial was published, and what you can see is one of these drugs, ipilimumab, 20% of the patients now are alive by 1 year, whereas they're almost all dead before. But if you add two of these immune modulating drugs, nivolumab and ipilimumab, almost half of the patients are still alive after a year. And that is a huge difference if you look over on the left compared to not even 10% of the patients alive previously before these drugs. So, I mean, this is just kind of a historical list, again, a little bit out of date of like the types of treatments that came online and when they came online, just to give you an idea. So X-ray radiation was discovered, and they just started pointing at different things, including cancers, and it killed some cancers, but it actually killed some people too. We talked about the first chemotherapies, the first remissions of childhood leukemia wasn't until 69 years ago. First metastatic cancer cured, first clinical trials, widespread use of combination therapies actually bumped you up to 40% survival rates in cancers, targeted therapies, and now we have these immune checkpoint therapies. And we're still waiting for all the data to come in, but it definitely has increased the number of patients that are alive today that would not have been alive 5 to 10 years ago if some of these therapies were not available widely and the research hadn't been done to bring those therapies to the clinic. So, what can you do to help out and, to maybe not get cancer? Well, obvious the ones that everybody's preached always. Don't smoke, drink in moderation, eat healthy, get screened as the guidelines are suggested to you. Talk to your doctor, that's the most important thing. Get your regular checkups and, when it's time to get screened, colonoscopies or mammograms, just get those done. It's almost universal that the earlier a cancer is detected, the better the outcome will be, okay? So that's really important. The earlier you catch a cancer, the better off that you're going to be, the more likely you'll be to survive it. But there are some things to be said about screening, and this is just one thing I'm going to leave you with. So this we see here is this is prostate cancer over the past 30, 40 years. And you can see that the number of deaths is pretty level, but the number of cases spiked like crazy in the 1990s. And that's because of PSA screening. And it turned out that everybody who was getting PSA screened thought that they had prostate cancer. And it turns out that prostate cancer is such a slow-growing disease in most cases that most men over the age of 65, 70 years old actually have something that may be diagnosed like prostate cancer, but it's so slow-growing that you'll die with it, not of it. And so you can see the PSA screening was kind of brought back there after late 90s because they were tired of these false positives that actually didn't have any outcomes with the patient survivals or patient incidents of actual aggressive disease. So finally, have we cured cancer? Unfortunately not. Not all cancers, not yet. But ask any of the 15.5 million living cancer survivors, which is about 5% of our population, what they think about us not being able to cure cancer. So, that number of 15.5 million living cancer survivors is going to jump to 26, almost double to 26 million by the year 2040, maybe even higher than that if these immunotherapies become more impressive. Finally, I'm not going to go through that. These are just some of the sources that are really great. Some of them are books that are made for non-scientists. The Emperor of All Maladies by Siddhartha Mukherjee was a Pulitzer Prize-winning book. I really would encourage you to read that one for sure. some of these other books if you want to get information. I thank you very much. Again, my name's Levi Beverly. Look back to Beer the Scientist YouTube channel for future talks. And we will see you at some time in the future. Thanks.